course. The lower limbs are extensions from the trunk. They are specialized to support the body weight. They are specialized for locomotion, the ability to move from one place to another and maintain balance. The leg contains two bones, tibia and fibula, and connects the knee and the foot. Various muscles are attached on these bones which are responsible for the movements performed by the leg. The leg can perform various movements at the ankle joint. It can perform dorsiflexion, plantar flexion, inversion, and eversion of foot. Learning objectives. By the end of the lecture, the student should be able to discuss the facial compartments of leg, explain the muscles of anterior and lateral compartment with its neurovascular supply, describe the clinical anatomy of the compartment involvement like the compartment syndrome. Bismillahir Rahmanir Rahim. Facial compartments of leg. Now you all know that the lower limb is encircled externally by a layer of connective tissue which is called as deep fascia. So deep fascia is a layer of connective tissue which is encircling the muscles of the lower limb. This deep fascia is sending inside septas which divide the leg into compartments. The two bones tibia and fibula are connected by a membrane which is called as interosseous membrane. The interosseous membrane also helps in creating the compartments. So two structures are responsible for the creation of compartments. First is the interosseous membrane and second are the septas which are extensions of deep fascia. We have two septas in the leg region, anterior and posterior intermuscular septas. So we have anterior and posterior intermuscular septas and the interosseous membrane. They are creating compartments. So in the leg, there are three compartments: anterior compartment of the leg, lateral compartment of the leg, and the posterior compartment of the leg. In today's video, we are going to discuss the anterior and the lateral compartment of the leg, their contents, their muscles, and the nerves and the vessels which are present in these two compartments. So, contents of the anterior facial compartment of leg. Now, in the anterior compartment, there are muscles, there is artery, vein, and a nerve. We have four muscles in the anterior compartment: Tibialis anterior muscle, Extensor Digitorum Longus muscle, Peroneal Tertius muscle, Extensor Hallucis Longus muscle. The main artery of this compartment is anterior tibial artery, and the main nerve of this compartment is deep peroneal nerve. We are going to discuss all these contents in the next slides one by one. So we said that four muscles are present in the anterior compartment. The first muscle, you have to look into the figure. The first muscle is the tibialis anterior muscle. The second muscle is extensor digitorum longus muscle. When you remove the tibialis anterior muscle, beneath it we will find extensor digitorum longus muscle. Then in the lower part there is a small muscle which is called as Peroneal Tertius, also called as Fibularis Tertius. and the last is Extensor Hallucis Longus muscle. All these four muscles are innervated by the deep peroneal nerve. Now you remember that sciatic nerve in the popliteal fossa divides into a tibial nerve and a common peroneal nerve. The common peroneal nerve then divides into superficial and deep peroneal nerve. So deep peroneal nerve is the main nerve of the anterior compartment. It supplies all the four muscles present in this region. Now these muscles are responsible for dorsiflexion, inversion of the foot, as well as extension of the toes. We are going to discuss one by one. The first muscle is tibialis anterior muscle. So you have to look into the figure. This is tibialis anterior muscle. Remember the osteology and muscle attachment of tibia. This is origin of tibialis anterior muscle. It is arising from the upper two-thirds of the shaft of the tibia. See, this is the upper two-thirds of the lateral surface of the shaft of the tibia. Tibialis anterior muscle arising from upper two-thirds of the lateral surface of the shaft of the tibia. The fleshy part of the tibialis anterior muscle is converted into a tendon. This long tendon runs downward towards the foot and it is inserted into the medial and the inferior surface of the medial cuneiform bone and the first metatarsal bone. Now you remember that we in the upper limb we told you that in hand there are carpal bones while in the foot there are tarsal bones. So in the foot there are tarsal bone and one of this tarsal bone is named as medial cuneiform. This bone is called as medial cuneiform. The name is medial cuneiform. In the hand we have metacarpals while in the foot we have metatarsals. So this bone is called as first metatarsal and these are the phalanges, right? So the tibialis anterior tendon is inserted on the medial and the inferior surface of the medial cuneiform and the first metatarsal bone. This muscle is innervated by deep fibular nerve. You can see in this figure the origin of tibialis anterior. It is arising from the upper 3/4 of the lateral surface of the shaft of the tibia and its tendon is inserted into the medial cuneiform and the first metatarsal. Now when this muscle is going to contract, it pulls the foot forward, it pulls the foot upward, it pulls the dorsum of the foot upward towards the anterior surface of the leg, and this movement is called as dorsiflexion of the foot at the ankle joint. So the most important movement which is the tibialis anterior is performing is dorsiflexion of foot. I hope you remember dorsiflexion. The meaning of dorsiflexion is moving the foot upward, the dorsum of the foot upward towards the anterior surface of the leg so that the sole faces forward. The second movement which tibialis anterior can perform is inversion of the foot. Inverts the foot at the intertarsal joint. Now, what do you mean by inversion of foot? It is the movement of foot in which the medial margin of the foot is raised from the ground so that the sole faces medially. The sole should face medially. This movement is called as inversion, and when the dorsum of the foot moves towards the anterior surface of leg, it is called as dorsiflexion. So these two movements, important movements, are performed by tibialis anterior muscle. Now during walking, the tibialis anterior provides dynamic support for the medial arch of the foot. Now what is medial arch of the foot? When you look the sole of the foot, you can find certain elevations and depressions. The foot is not flat. It has certain elevations. The elevations are called as arch. So the most prominent arch is the medial arch of the foot, and it is supported by the tibialis anterior muscle. तो tibialis anterior बच्चे क्या काम कर रहा है? Number 1 dorsiflexion, number 2 inversion of the foot, and number 3 supports the medial arch of the foot. The second muscle is extensor digitorum longus muscle. Extensor digitorum longus muscle. The extensor digitorum longus muscle, it is arising from the lateral condyle of tibia as well as from the upper two-thirds of medial surface of fibula. Now we will look into the figure. See, it is arising from, this is extensor digitorum longus. It is arising from the lateral condyle of tibia as well as from the upper two-thirds of the medial surface of the shaft of the fibula. We will look the bone. This is the origin of extensor digitorum longus. You can follow from here. Extensor digitorum longus is arising from the upper two-thirds of the medial surface of the shaft of the fibula as well as from the lateral condyle of the tibia. Very clear picture of the origin. Now the fleshy part is converted into a tendon, and when the tendon crosses the ankle joint, it splits or it divides into 4 tendons. It divides into 4 tendons, and these 4 tendons run towards the lateral 4 toes. You can see it is divided into 4 tendons, and the 4 tendons run towards the lateral 4 toes. The extensor digitorum longus tendon inserts via dorsal digital expansion into the dorsal surface of the base of the middle and the distal phalanx of the lateral 4 toes. Now look in this figure. This is the tendon of extensor digitorum longus. This is the tendon of extensor digitorum longus. It splits into 4 tendons, right? It splits into 4 tendons. 1, 2, you can see the second tendon, the third tendon, and the fourth tendon, right? Now these 4 tendons move towards the lateral 4 toes. पहली बात तो ये हो गई. Second thing, they are inserted via the dorsal digital expansion. This is dorsal digital expansion. Now what actually it is? It is a triangular aponeurosis. It is a triangular aponeurosis formed by the expansion of the tendon of the dorsal of the extensor digitorum longus. क्या कहा मैंने कि dorsal digital expansion क्या होता है It is a triangular expansion of the tendon of the extensor digitorum longus. Aponeurosis formed by the tendon of extensor digitorum longus. तो पहले तो ये 4 टेंडन्स में स्प्लिट हो गया, फिर इसने क्या किया, इसने एक ट्रायंगुलर एपोन्यूरोसिस बना दी. इस ट्रायंगुलर एपोन्यूरोसिस को हम क्या कहते हैं, डोर्सल डिजिटल एक्सपेंशन. Now what happens, look carefully into the figure, that the center slip is inserted into the middle phalanx. It divides into a central slip and 2 peripheral slips. The central slip is inserted into the middle phalanx, while the peripheral slip, what happens to the peripheral slip? I'll change the color of the highlighter to show it to you. While the peripheral slips, you can see, they move upward, they again unite, and they are inserted into the distal phalanx. So this is how the dorsal digital expansion is formed. I'm repeating, the extensor digitorum longus tendon, first it divides into 4 tendons which move towards the lateral 4 toes. Then it forms the dorsal digital expansion, which is actually a triangular aponeurosis, flat aponeurosis formed by the tendon of extensor digitorum longus. How it is formed? The tendon splits into a central slip and into 2 peripheral slips. The central slip is inserted into the middle phalanx. You can see very clearly in this one as well. The central one is inserted into the middle phalanx, and the peripheral slips move forward, move distally, and they unite with each other and they are inserted into the distal phalanx. So this insertion pattern is called as dorsal digital expansion. यही same चीज you have done in the hand as well. Okay जी. So we will move to the next now. The extensor digitorum longus, we said all these muscles are supplied by deep peroneal nerve. Now it is performing 2 functions. The first extends the toes, and second dorsiflexes the foot at the ankle joint. So it is crossing the ankle joint. When it contracts, it will dorsiflex the foot at the ankle joint, and second, it will lead to extension of the toes. It is doing extension of the lateral 4 toes because it is supplying the lateral 4 toes. The third muscle is extensor hallucis longus. The word hallucis is used for the big toe, the great toe. It is arising from the middle half of the anterior surface of the fibula. Now you can look clearly into the figure. It is arising from the middle half of the anterior surface of the fibula, and it is inserted into the base of the distal phalanx of the great toe. This is the distal phalanx of the big toe. So it is inserted into the base of the distal phalanx of the big toe. It can perform extension of the great toe as well as dorsiflexion of the foot. So extension of the big toe is performed by extensor hallucis longus. Extension of the lateral 4 toes is performed by extensor digitorum longus. The last muscle is the Peroneus tertius muscle. Some author says that it is a part of extensor digitorum longus. The Peroneus tertius muscle arises from the lower 1/3 of the anterior surface of the fibula. This is the lower one third of the anterior surface of the shaft of the fibula. It gives origin to the peroneus tertius. The tendon of the peroneus tertius is inserted into the medial side of the base of the fifth metatarsal. This is the fifth metatarsal, and you can see the tendon is inserted into the base of the fifth metatarsal. The muscle can perform dorsiflexion of the foot as well as eversion of the foot. Now, what do you mean by eversion of the foot? Eversion means movement of the foot in such a way that the lateral margin of the foot is elevated from the ground so that the sole faces laterally. This is eversion of foot. So we have done the four muscles. We are going to revise these four muscles. The first is Tibialis Anterior. Second is Extensor Digitorum Longus. Third is Extensor Hallucis Longus. And the fourth is Peroneus Tertius muscle. The artery of this compartment is the anterior tibial artery. Now you can see this red colored artery. This is the anterior tibial artery. It originates from the popliteal artery in the posterior compartment. It passes forward in the anterior compartment through an aperture in the interosseous membrane. Now here you can see there is an aperture in the interosseous membrane through which the anterior tibial artery enters into the anterior compartment. It runs between the muscles and it gives off numerous branches over here. It gives off a recurrent branch which move towards the knee joint. It gives muscular branches. It gives anterior medial malleolar artery. This is anterior medial malleolar artery. This one, anterior medial malleolar artery, as well as anterior lateral malleolar artery. This is anterior lateral malleolar artery. The anterior tibial artery leaves the leg by passing anterior to the ankle joint, and it continues as the dorsalis pedis artery in the foot. So this is the dorsalis pedis artery. It is actually the continuation of the anterior tibial artery in the foot. The nerve of this compartment is the deep peroneal nerve. The deep peroneal nerve originates in the lateral compartment of the leg as one of the two divisions of the common peroneal or common fibular artery. I told you that in the popliteal fossa, sciatic nerve bifurcates or divides into two nerves, common peroneal nerve and the tibial nerve. The common peroneal nerve further divides into two branches, a superficial branch and a deep peroneal nerve. The deep peroneal nerve enters into the anterior compartment by passing between the muscles, and it supplies the muscles of the anterior compartment. Now, whenever there is injury to the peroneal nerve, because it is lying in a very superficial area, it winds around the neck of the fibula, which is a vulnerable position. So if there is injury to the peroneal nerve, there is development of a condition which is called as foot drop. The foot drop is actually inability to lift the front part of the foot off the ground. Means inability to perform dorsiflexion. Now you know all the muscles of the anterior compartment are responsible for the movement of dorsiflexion, and whenever there is injury to the peroneal nerve, the dorsiflexion movement is affected. It is impaired. The condition is called as foot drop. Lateral compartment of the leg. Chale, second compartment. It is very simple and very small compartment. The lateral compartment of the leg, it contains two muscles, peroneus longus and peroneus brevis muscle. The peroneus word is interchanged with fibularis also. So you can say fibularis longus muscle and the fibularis brevis muscle. The artery of this compartment is the peroneal artery and the nerve is the superficial peroneal nerve. Peroneus, two muscles in this region we said, peroneus longus and peroneus brevis. Both of them are supplied by the superficial peroneal nerve, and these muscles are responsible for plantar flexion of the foot and eversion of foot. Now, what do I mean by plantar flexion of foot? It is the movement of foot in such a way that the sole faces backward, or when you stand on your toes, जब आप अपनी उंगलियों पे खड़े होते हैं, this is plantar flexion of foot. Standing on your toes so that sole faces backward. Second movement performed by these muscles is eversion of foot. The first muscle, peroneus longus, we are going to discuss the origin and insertion. Now see, the peroneus longus is arising from the head and the upper two-thirds of the lateral surface of the fibula. This is fibula. It is arising from the upper two-thirds of the lateral surface of the fibula. The peroneus longus muscle, its fleshy part is converted into a tendon. The tendon runs downward. It crosses the undersurface of the foot and it reaches the medial cuneiform. इसकी insertion थोड़ी सी tricky है. You see, this is a lateral muscle, right? It is crossing the foot, the undersurface of the foot, to reach the medial surface of the foot, and it gets inserted into the medial cuneiform and the first metatarsal. Medial cuneiform and the first metatarsal. अब कुछ याद आ रहा है? Which muscle was inserted into the medial cuneiform and the first metatarsal? It was tibialis anterior muscle. तो दो muscles हैं जो same जगह पे insert होते हैं, peroneus longus and tibialis anterior muscle. I am revising this muscle. The peroneus longus muscle arises from the head and the upper two-thirds of the lateral surface of the fibula. The fleshy part is converted into the tendon and the tendon runs downward behind the lateral malleolus. This is an important landmark. It runs behind the lateral malleolus. You can see it crosses the undersurface of the foot. This is the Fibularis longus tendon. See, it is crossing the undersurface of the foot and it is inserted into the medial cuneiform and the first metatarsal. Okay, again you can see in this figure that it gets inserted. This is the tendon of the peroneus longus muscle. It is crossing the undersurface of the foot and it gets inserted into the medial cuneiform and the first metatarsal. Very clear picture to show you the insertion of peroneus longus. The peroneus longus, it everts the foot as well as it plantar flexes the foot. Now, peroneus longus supports mainly the lateral arch and the transverse arch of the foot. I told you the foot has elevations and depressions. The most prominent arch is the medial arch, and we have a lateral arch as well as a transverse arch. They will be discussed in the next lectures. So, the peroneus longus is supporting the lateral and the transverse arch. The second muscle is the peroneus brevis, also called as Fibularis brevis. It arises from the lower two-thirds of the lateral surface of the fibula. Upper two-thirds से कौन arise हो रहा है? Fibularis longus, and lower two-thirds is giving origin to the Fibularis, or you can say peroneus brevis. Now again the fleshy part is converted into a tendon. The tendon passes behind the lateral malleolus and it is inserted into the base of fifth metatarsal bone. See, this is the base of fifth metatarsal bone. The muscle is inserted into the base of fifth metatarsal bone, the peroneus brevis muscle. कुछ और याद आ रहा है? पेरोनियस ब्रेविस के साथ साथ फिफ्थ मेटाटार्सल पे कोई और मसल अटैच होता है? अभी अभी हमने पढ़ा. I'm going back. One more muscle was inserted on the fifth metatarsal. It was the peroneus tertius muscle. कहाँ गया भाई? It was the peroneus tertius. Look into this figure. Base of fifth metatarsal, peroneus tertius. So along with peroneus tertius, peroneus brevis muscle is also getting inserted into the base of fifth metatarsal. Now I know that to memorize the origin and insertion is quite difficult, but you have to go through the book twice or thrice along with the pictures, along with the images. You can remember the images, but you will forget the text. तो images को अपने दिमाग में बिठा ले, pictures को अपने दिमाग में बिठा ले, then इंशाल्लाह आपको याद हो जाएगा. The peroneus brevis everts the foot. It is performing eversion of foot. The artery of the lateral compartment. It is supplied by branches from the peroneal artery or the fibular artery. This is the fibular artery. ठीक है? In the posterior compartment of the leg that penetrate into the lateral compartment. Actually, lateral compartment does not have any main artery. It receives branches from the fibular artery, and fibular artery is actually the artery of the posterior compartment. And इसके पास अपने पास कोई artery नहीं है, तो ये posterior compartment की fibular artery से branches लेके muscle supply होता है. This is fibular artery. Fibular artery is actually a branch of the popliteal artery. The fibular artery gives off branches which supply the lateral compartment of the leg. You can see in the figure, the branches of fibular artery supply the lateral compartment of the leg. The nerve of this compartment is the superficial peroneal nerve. We told you that the common peroneal nerve, the common fibular nerve divides into a superficial and a deep branch. The deep branch supplies the anterior compartment and the superficial branch supplies the lateral compartment. It enters the lateral compartment from the popliteal fossa. The superficial peroneal nerve descends in the lateral compartment between the muscles. It supplies the muscles of the lateral compartment. There are two muscles, peroneus longus and peroneus brevis. Now what it does, it then penetrates the deep fascia and enters the foot. See over here, this is the superficial peroneal nerve. It pierces the deep fascia and enters the foot, and here it divides into a medial and a lateral branches. which supply the dorsum of the foot. It supplies the dorsal area of the foot and toes except for the web space which is present between the great toe and the second toe, which is supplied by the deep fibular nerve. It supplies the lateral part of the leg as well as the dorsum of the foot, except the web space between the great and the second toe, which is supplied by the deep fibular nerve, as well as it does not supply the lateral side of the little toe, which is supplied by the sural nerve branch of the tibial nerve. So this area does not receive the innervation from the superficial peroneal nerve. The rest of the dorsum of the foot is supplied by superficial peroneal nerve, except these two areas. Web space between first and second toe and the lateral side of the little toe. Compartment syndrome. It is a painful condition that occurs when the pressure within the muscles build to a dangerous level. Now we know that the leg is surrounded by a layer of connective tissue which is called a deep fascia. Because of the presence of the deep fascia, if there is any accumulation of blood or fluid, it leads to increase in the pressure, and the increase in the pressure can lead to compression of the vessels, compression of the arteries, and can lead to ischemia of the muscles. So this pressure can decrease the blood flow and prevent the nourishment and oxygen from reaching the nerves and the muscle. It is a painful condition and the treatment is fasciotomy, cutting the fascia, opening the fascia so that pressure is released. Summary, we have done the anterior compartment having the four muscles and the main artery was deep fibular nerve. The lateral compartment having two muscles and the nerve of this compartment is superficial fibular or the peroneal nerve. The text was taken from Gray's Anatomy as well as from Ethan Moore. Thank you so much.